Hi! In some of my earlier videos with the River Health, you might have seen how it works for the clinicians and nurses and so forth, the unbreakable flows, the workflows. In this case, we're going to do something different. I'm going to log on as Peter Smith. He's a patient. So this is the patient interface, where you can see bookings and location if he's still in the hospital, etc., current problems, old problems. You can see his old problem with all the details. You can also add notes to it, so it becomes a part of the record automatically and visible by anybody. And if it's a current problem, of course, his doctor will see it as well in his interface. And he has a list here of all clinicians that he has ever met or has touched upon him. And we got allergies, which can be edited, and other general history cases, and the same for street address and so forth. So let's say Peter is out traveling. This time he's in Ireland out cycling, and he has a bike crash again. So he's going to visit a local practitioner, and it would be useful if that practitioner had access to his home country health record, and also be able to add a new case to it, so his doctor at home or his other hospitals or whatever has access to whatever happens here in Ireland. So for that we have this external clinician access, and it's totally up to the patient to give it or not. So he's going to do that. Yes, let me give and add a clinician. There were no search here, but otherwise he could search through if somebody is already in the system. And for simplicity, I would, in this case, hand over my iPad or iPhone and let the doctor fill him in himself. And I'm ready to fill it in. And I get this message that now the clinician has access to my medical records and can add notes. But I'm not going to let him do that. I could actually use my iPad, but I have to log out anyway. I'm going to log on again as Shane. And he has this interface, which is very simple. Actually, he has not much to do but to check out the patient records, which is in the normal format with the problems and background, etc. So he has access to everything. And he can add a new problem at this case, which then automatically becomes a part of your health records, visible to anybody afterwards. In this case, there might be something with this old case here. So he's going to click on the casework, and he has everything in his face, and he can add some text, make it simple. And he can add details from an X-ray, patient communication. He has the full medical records again accessible here, so he doesn't have to change interface. And we're going to leave this as not current. It was not a big issue, so I've done my job. And if I log out again and go back to Peter's interface, the only thing Peter has to do now is to click on complete, at which point then Shane, the Irish practitioner, will have no access at all to my records anymore.